Hello friends, myself Dr. Shardul Joshi. Today we are going to discuss about the Phatak's Materia Medica. We are going to study what are the strengths of Phatak Materia Medica, how to study Phatak's Materia Medica through understanding what Phatak has written in the introduction and preface of his Materia Medica. In last video, similarly we have done for Kant's Materia Medica, understanding the preface of Kant's Materia Medica and how to read and how to understand Kant's Materia Medica. So similarly we are going to discuss about the Phatak's Materia Medica today. So Dr. Phatak was originally a allopathic doctor. He was MBBS pass out and he was having a very good allopathic practice. Eventually he turned towards homeopathy and he is one of the stalwarts. He has contributed a lot for homeopathy through his works like Concise Repertory and this Materia Medica. So Phatak's Materia Medica is basically based on Boger's Materia Medica. And as we know, Boger was the disciple of Boning Hussain. And he was well known as a man with a few words. And so was the Phatak. He would give essence of any remedy, any drug in few words. So this book is very useful, very concise and can be used as a quick bedside reference. Phatak's Materia Medica can be classified under the clinical Materia Medicas like Borik's Materia Medica. Because lot of modern terminologies, diagnostic terms Phatak has mentioned in his book. So to begin with, Phatak writes the preface and in introduction he writes a chapter called Hints for Beginners. And this both preface and these chapters are very important, my friend. You should read this first and then you should start reading Phatak's Materia Medica. So we'll try to understand what Phatak has given instruction or hints for the beginners. So listen and read very carefully what Phatak writes in this. Drugs should become your friends. You can identify your friends from the way he rings the bell, taps or opens the door, climbs the footsteps, etc. Similarly, you should be able to know the drugs even when partially seen. So Phatak says, if you are able to see the glimpse of remedy, you should able to identify the remedy. वो ड्रग की खाली झलक काफी है, वो झलक से ही आपने पहचानना है कि ये कौन सा ड्रग हो सकता है. And you can go and you can ask the questions and confirm the remedy later on in the case. तो फाटक क्या बोल रहा है कि रेमेडी शुड बी योर फ्रेंड. दोस्त कैसा होता है, फ्रेंड कैसा होता है, हम उसके आहट से उसको पहचान जाते हैं, राइट. तो वो झलक मिल जाए तो वी शुड एबल टू अंडरस्टैंड द रेमेडी एंड हाउ टू डू दैट. ही गिव्स दैट ऑल्सो. तो इन प्रीफेस फाटक राइट्स हाउ टू आइडेंटिफाई द ड्रग. क्या झलक, वो झलक अगर मिल जाए तो वो झलक क्या होती है. ही राइट्स द जनरलिटीज, मोडालिटीज एंड माइंड. दीज थ्री थिंग्स आर वेरी इंपॉर्टेंट. दीज आर द मार्क्स ऑफ आइडेंटिफिकेशन ऑफ एनी ड्रग. अगर आपको ये मिल जाए तो बस यू कैन आइडेंटिफाई द रेमेडी. फॉर एग्जाम्पल, इफ पेशेंट कम्स टू यू एंड ही सेज, डॉक्टर ऑल माई कंप्लेंट्स आर लेफ्ट साइडेड, सब लेफ्ट साइड पे ही होता है. And I cannot bear the tight clothing around the neck, around the abdomen. And all complaints get aggravated as soon as I get up from the sleep in the morning, waking up. And person is very loquacious, continuously talking and talking. Okay, so what remedy comes to our mind? Yes, lachesis. So lachesis is the remedy. You can identify lachesis from these general symptoms, the characteristic modality and the most important mind symptom. So this is the identification or the marks of identification of lachesis. ये झलक मिल जाए तो हमको पता चलता है ये लैकेसिस है, इर्रिस्पेक्टिव ऑफ पैथोलॉजी, मे इट GIT, किडनी और एक्सट्रीमिटीज, जॉइंट, डजंट मैटर. If you get this, you can go and find out, you can rule out the lachesis. So how to make the homeopathic drug your friend? So he has given in the generalities. So in the structure, how he has written his Materia Medica, every drug in this format. He first write the generalities, then modalities, aggravation, amelioration, then mind symptoms, important mind symptoms, and then particular symptoms about the particular system and organs. So this is the structure. In the same hierarchy, he gives the Materia Medica, any drug. So for example, if you see Kali Carb, it is there on your screen. If you see, he start with the generalities of the Kali Carb, then the worse means aggravation, better, amelioration, so modalities, followed by important mind symptoms. And then from head to toe, he gives the all particulars and ending with relationship of the remedy. Okay, so generalities, the first paragraph of generalities of any drug is most important in Phatak's Materia Medica. It is the power packed section of the that drug. You can get the soul, essence or core of the remedy in this generalities paragraph. So what he writes in that, he writes about the profile picture, the physical constitution, he writes about the general traits of the remedy, he writes about the affinity, okay, sphere of action, which system, which organ is getting affected by this remedy, the common diseases, the elements from causation, he writes in the generalities. And if you are able to understand the generalities of the remedy, the half work will be done. Okay, so we'll try to understand, try to read or try to learn Kali Carb from the Phatak's Materia Medica. If you see the generalities of Kali Carb, what he writes, listen and read very carefully. So weakness, so whatever he writes in italics is very important, please remember. So what he write, weakness of the muscles, of heart, of the back, of limbs, weakness of intellect. So you can see weakness is running through and through Kali Carb. It is there on the physical level, it is there on the mental level. You can see the weakness in the limbs, in the muscles, in the heart. So everywhere you will see the weakness. So now you can understand weakness is the central theme, is the one of the main general trait of Kali Carb. Okay, then he writes the organ affected, fibrous tissues, ligaments, joint, okay, of uterus, of lumbar back, right? So the affection of Kali Carb is on fibrous tissue, on connective tissue, on muscles, ligaments. So this is how the understanding of Kali Carb develops when you read carefully the generalities from Phatak's repertory. Then further he writes, this is very important symptom of Kali Carb. Sweat, backache and weakness are three characteristic symptoms of Kali Carb. So when you get this trio of a profuse sweat, exhausting sweat with weakness and backache, you can think of Kali Carb. That is what Phatak suggests. Then he writes about the next general trait, about the kind of general sensation running through the Kali Carb is the pain, sharp, stitching, stabbing, catching pain are felt in various part of the body. And then he gives the list of organ and then he says etc, etc. Okay, chest, muscles, head, okay, affected side, etc. So that etc is very important. One is italics and then this etc means it is the general. In every part of the body you will get the same kind of pain. Or with any affection, whatever may be the affection, kidney, GIT, head, joint, the pain will be stabbing, stitching, sharp pain in Kali Carb. So we got this one more general trait. Then you go down, he talks about the element from never well since pneumonia. So anything, any complaint starts after the pneumonia, patient is not well since pneumonia, you can think of Kali Carb. Then he gives one more general trait of startling, tendency to start. When touched, when there is loud sound, when somebody touching the sole or feet, Kali Carb startles. So startling is also one of the general trait. Then he talks about the more elements from or more causation, ill effects of suppression of eruption or not well or debilitating states after miscarriage or labor. So Kali Carb patient will have aggravation after delivery, after abortion. That also one more causative factor we get. Okay, so if you try to understand Kali Carb in nutshell, so in general it is what we got from Phatak, that weakness is very important trait of Kali Carb. Weakness will be at general level, physical level, mind level, emotional level, intellect level. Everywhere you will get the weakness. What is the affinity? Muscles, fibrous tissues, joints, ligaments, back. Pain will be sharp, stitching, shooting, stabbing kind of pain. And startling will be there. Elements from after pneumonia, delivery, suppression of eruptions, after abortion. So if you get this kind of general trait of weakness, of sharp stabbing pain, stitching pain, patient is saying that doctor, I get aggravated after midnight around 3 a.m., 4 a.m. and person is having fear of being alone. He is not able to stay alone. He wants his family, friends around, yet fights with them. If you get this characteristic mental symptom, modalities and this general state, definitely you can think of Kali Carb. Go and try to find, search in the case, try to match Kali Carb, try to rule out Kali Carb. So this is the mark of identification of Kali Carb. And this is, and when you understand this, when you learn this, when you remember this, Kali Carb will become your friend. So this is how you have to study the Materia Medica, Phatak's Materia Medica. So there are few additional symptoms also which you cannot find in any other Materia Medica. In preface, Phatak starts with the same idea. What he says, you have to read different Materia Medica to get the complete idea, understanding of any remedy. So I had a case, and the case was of young female, and she was suffering with piles, and a very characteristic symptom I got, that her piles bleeding will get aggravated during urination. Okay, during stool, piles getting aggravated, bleeding getting aggravated is very common symptom, but she said during urination, very specific. So I searched this rubric in Phatak's repertory, piles, aggravation, urination during. So I got Kali Carb as the single remedy. And when I read the Kali Carb from Phatak's repertory, you can read the underlying symptom. Piles, inflamed, bleeding, descend when urinating and coughing. I prescribed her Kali Carb and she responded beautifully to Kali Carb. If you try to read the same symptom, same from Boric's Materia Medica under the rectum, you will not get this symptom. Boric has written piles get aggravated during coughing, urinating only Phatak has mentioned. So these are the added advantage of reading different Materia Medica. You get the additional symptom, additional knowledge of that drug, and this is what idea of Phatak, and this is what Phatak has written in the preface also. Then he writes how to study Materia Medica, how to read Materia Medica. In detail he has mentioned. So what he says in that hints to beginners, he writes, studying the Materia Medica is a long drawn effort. There is no short or easy road to success. This is very important, my friends. If you want to master the Materia Medica, process will be tedious, long. You have to put lot of efforts. There is no shortcut to master Materia Medica. You have to read and apply that in practice. Then only you can master it. Drugs should be your friends, and how to make drugs your friends. He has given the marks of identification. You should able to understand the generalities, characteristic modalities and characteristic mental symptom. If you understand the three things, drugs will become your friends, and we saw the example of lacasis and Kali Carb. So the mark of identification, please remember, generalities, modalities and mind. Then what he says, to achieve this, to master Materia Medica, what we have to do? We have to read the Materia Medica with the repertory. Read the symptom and try to find out that symptom from repertory. Then you will able to understand different other remedies from that rubric. You will able to compare the remedies and the understanding will increase more. And at the end he writes, read different Materia Medica to get the wider picture of that remedy.